Hello, my name is Marvella Garcia, and I'm going to be talking about cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, began its emergence in the mid-1970s. The foundation of cognitive behavioral therapy evolved from two domains. The first being the field of behavior therapy, which at that time had began to incorporate conceptions that had dealt with internal cognitions and emotions. An example of this would be the social learning theory by Bandura, and the other domain being rational emotive therapy and cognitive therapy, which were both psychotherapies that focused on cognitive assessment and cognitive change as being responsible for creating behavioral adaptations in emotional success. Early theorists involved were Albert Ellis, John Whiteley, and Aaron T. Beck. While Albert Ellis and John Whiteley were involved with rational emotive therapy, Aaron Beck was responsible for the development of cognitive therapy, which came about when he developed a treatment protocol for depression, treating it more as a cognitive disorder rather than a mood disorder. Cognitive behavioral therapy can be defined as a treatment model of psychotherapy that is flexible, continuously evolving, and contextually driven, a tool that is used to treat a wide range of mental health and physical issues worldwide. CBT is an effective tool because it has the ability to be tailored to the individual, making this an ideal intervention for understanding a patient's unique difficulties and allowing the mental health professional to develop techniques that can be used to overcome those difficulties within a cultural and societal context that is unique to the individual patient. CBT can be used in a diverse range of clinical populations. It can be used as a standalone treatment, or it can also be used with other treatments, such as being used in conjunction with medications. It can also be applied in various different settings. Different types of CBT developed to treat different mental health disorders are recognized as evidence-based treatment by the American Psychiatric Association and many other organizations globally. Studies show that cognitive behavioral therapy has the ability to lead to an improved quality of life and functioning. Cognitive behavioral therapy has proven through various studies to be as effective, and in some cases it can be considered even more effective than other types of psychological therapies and even psychiatric medications. Cognitive case conceptualization is a key part of cognitive behavioral therapy, which includes gathering all of the necessary information to create an overall evaluation of the individual patient. The foundation of cognitive behavioral therapy is shown through the different ideas that cognition really is the mediator between the relationship of events or stressors in an individual's life and an individual's reactions to those specific stressors or triggering events. Cognitions within an individual do not exist unconsciously, but exist in a way that can be monitored with the right training and the right technology. And finally, systematic changes to cognition itself can lead to deliberate positive therapeutic outcomes. Cognitive behavioral therapy treatments aim to change an individual's thinking patterns and behavioral patterns to effect positive change. Cognitive behavioral therapy involves an in-depth collaboration between the mental health professional and the patient to identify and understand what the existing problem is and work together to develop specific treatment strategies. Cognitive behavioral therapy sessions focus on what is currently occurring in the individual's life. With the help of different unique, tailored strategies and techniques, patients are taught how to develop healthy coping skills. And finally, the main goal of cognitive behavioral therapy is really to empower patients through a strong therapeutic alliance to be able to change their thought patterns, behaviors, and emotions in order to develop the necessary and effective skills to cope with life and create successful long-term outcomes for all patients, no matter what mental health issues they are facing. Here is a list of the references that were used throughout this presentation, and I thank you so much for your time and for viewing the presentation. Thank you.